Hi, Dr. Riaz Agha here at Harley Clinic on Harley Street. I want to talk about recovery after a blepharoplasty or eye lift surgery. The blepharoplasty can either be the upper lid, the lower lid, or both. It can be sometimes combined with other procedures as well at the face. So recovery depends on what's done and the extent of the surgery. Generally speaking, you've got a little bit of swelling, which tends to last a few days but gradually settles down. The sutures tend to come out at about day 3 to 5, day 6 max. So the sutures will be removed in that period of time, and that patients feel a bit better after that. Pain control, it's really not a very painful operation, but generally paracetamol, ibuprofen, maybe codeine or tramadol if they need it, but generally it's controlled by simple painkillers, and the pain tends to be there really in the first few days up to a week maximum. So gradually the swelling and the pain tapers off after that first week. In terms of showering, they can shower after the procedure, but just need to be careful they don't get the sutures very wet, so they can shower the rest but not get really wet in the eyes. They can clean with a cold flannel. They can use chloramphenicol eye ointment on the actual wound itself, which helps to reduce the risk of an infection, helps to keep it lubricated as well. And in terms of sleeping, they should sleep with their head up to facilitate reduction of swelling and venous drainage, and that should be on, say, 2 pillows or so for the first week until they come back and see me and have their sutures removed day sort of 5. And in terms of exercise, they shouldn't be exercising really for the first few weeks after this procedure because they could put tension on the wounds, cause a problem. So I would advise them not to for that sort of first 2 weeks at least, not to exercise.